Manager of the Transcultural Mental Health Centre, and welcome to our TransFORUM for Refugee Week 2024. Before we begin our TransFORUM today, though, I want to note that I'm on Darug land, and I begin with acknowledging the Darug people as the traditional owners and ongoing custodians of the land. I pay my respects to the Darug elders past and present. And as we are online, I want to acknowledge the many traditional countries and language groups that everyone is meeting from. And I also pay my respect to First Nations people that may be here with us today. Furthermore, I also acknowledge people with lived experience of mental health issues and people with lived experiences as migrants or as refugees, and the courageous journeys of many generations of Australians who have made Australia what it is today. During Refugee Week, we acknowledge the strength and resilience of refugees, those seeking asylum, and displaced people in their search for a life free from fear and persecution. We recognise the unique experience of their journey, and we support their arrival and settlement and wholehearted participation in Australia. So thank you all for attending today, and thanks to the organisations involved, both the panellists and the participants that we have here today from many services within New South Wales Health, but also outside of New South Wales Health and non-government organisations as well. So happy Refugee Week and a warm welcome. Thank you also to our panel participants, Sandy, Shamron, Rachel, Mona and Amanda, whose organisations and whose professional backgrounds and interests have been listed in the screens that we've had playing as you have been entering. Now, World Refugee Day 2024 is this Thursday on the 20th of June. And at the global level, the World Health Organization campaign, together with the United Nations High Commissioner for Refugees, the UN Refugee Agency and partner agencies, focuses on the inclusion and solutions for refugees to ensure their access to health services anywhere, anytime. And this year's local theme, coordinated by the Refugee Council of Australia for Refugee Week, is Finding Freedom, helping refugee families thrive. This continues on from the theme from last year as well. The global refugee crisis continues to affect millions of people, with persecution, war and violence driving people from their home countries. And therefore, people with refugee experiences face numerous challenges, including language and cultural barriers, trauma and the loss of loved ones, which may impact their ability to keep healthy and well even when they arrive to countries such as Australia. So the aim of our forum today, our webinar, through our panel discussion, is to learn about current research related to families with refugee and asylum seeker experiences, and to build awareness of the services and resources that support families with refugee and asylum seeker experiences. This will support the ongoing building of clinical capacity of health professionals in our mainstream services to assist those individuals who might present to our services. Now, I'd like to introduce Emmeline, who is a mental health consultant at the Transcultural Mental Health Centre and working specifically in our refugee mental health program. She provides support and training to mental health professionals on an ongoing basis, using her experiences to assist in developing services that are inclusive of culturally diverse communities, but fundamentally understand the specific needs and requirements of our refugee communities. Now, as a clinical psychologist, Emmeline has previously worked with migrants and refugees, working across the fields of chronic pain, medical rehabilitation and psychological medicine in both public and private settings. And we are grateful that we have had Emmeline working with Transcultural Mental Health for a number of years now. So over to you, Emmeline. Thank you.
Thank you, Maria, and happy Refugee Week, everyone. As mentioned by Maria, I work within the TMHC statewide refugee mental health program, which has a community and a clinical component that work in tandem, taking a structured approach in strengthening the mental health of new and emerging populations. And it is through this program that we bring today's TransFORUM. So I just want a quick reminder that we are recording this session as a learning resource, and it will be on our website for future reference. So today we will be having a conversation about how we can help families thrive and not just survive when they arrive in Australia and come to attend our health services for support. I will invite the panelists today to respond to the questions and share their views. So hopefully you've had a chance to read our panelists' bios prior to the webinar, either on the intro slides that were shared at the beginning or access them through the Humanitics Virtual Event Hub. If not, feel free to check after the talk. I just really wanted us to get right into the discussion. So I'll just briefly introduce each panelist, their role and organisation. So we have Associate Professor Shamran Suayunyan from the School of Medicine at the Western Sydney University. I'm just reading across my screen as I can see your faces. I have Mona Naruzi from a child and family counsellor from the Child and Family Health in Western Sydney Local Health District. Have Sandy Eager from Refugee Health Service, who's the nurse manager there. Rachel Hennessy, a refugee student education advisor at the Multicultural Education Department at the New South Wales Department of Education. And last but not least, Amanda Mason, bilingual clinical consultant and child youth family consultant here at TMHC. Now, I just wanted to, everyone to just please be aware that we will be discussing some difficult issues. So be mindful of how this might impact you and please take care of yourself. Now, we've had some great questions come through registration, as you can see on the screen, and we should be able to respond by incorporating them into our broader questions and through the conversations we're having today. If not, we will come back to them at the end during Q&A, and so please feel free to add any other questions in the chat box as well. So let's start with what mental issues might arise. How might individuals with refugee experiences present to mental health services, and what issues might come up for these individuals and their families? Can I get Mona maybe to start and share her views on this?
Hi, everyone. Thanks for having me. And I just wanted to acknowledge that I am going to speak today from my lived experience of being a refugee, but then also as a professional that been working, privileged enough to work as a social worker and counselor with refugee population, but then also a non-refugee population. And in this current role, my target client group are non-refugees. Just thought to put it outside as well, put it out there for people to know that. But from my experience, a lot of the refugees are susceptible to and they are at risk of having a lot of mental health illnesses or developing mental health disorders. But then in saying that, that doesn't mean every refugee will be going to have those kinds of diagnoses. Often a lot of refugees, what they experience is signs of mental health concerns and illnesses such as anxiety, depression, sleep issues, or emotional dysregulation, problems around that. But then when you delve deeper, you see that those problems are very closely linked with other issues within their family system, because this family system kept them safe all the way from the beginning to that destination country. And it was like a safe place for them. And then now in this new context, because of all those changes, now there are problems that are created because of the changes and shifts in the family hierarchy, the parentification, and the power imbalance, and a lot of social issues, and, you know, again, discrimination in the new destination. So there are also other problems that I've seen and I have experienced as a refugee, was a lot of parent-to-child relationship issues, parenting problems, not being able to fit in, and a lot of family conflicts that has, you know, added to the anxiety and depression and other signs of mental illness that people usually arrive in the destination country with. Yeah.
Yeah. Was there anything that you wanted to add, like Shamron or Amanda? Oh, sorry, Emma. Yeah, thanks, Shamron.
Sorry, I think Mona did a very good summary of presentations and some important issues to consider. I mean, from a research perspective, we know that some of the common presentations that people come in with, you know, are PTSD, major depression, anxiety disorders. But I think it's very important that we don't focus so much on those specific disorders, but focus on why and how and where and all of those kind of contextual factors. I think that a lot of the kind of points that Mona raised around, you know, the disconnect, you know, the you know, pressure from a acculturation perspective, that really plays a big role in that kind of family dynamic. From a research perspective, I've got a couple of PhD students really actually looking at some of these things, including one student who's actually looking at how Arab men navigate mental health services, which is quite an interesting, we're getting quite interesting, you know, information from that piece of research, and particularly around that, you know, dynamic between families, changes of identity, and how that really pressures and puts pressures on families. So, yeah.
Oh, that's really great insight, I guess, in terms of that thinking, not just about the individual, but that contextual stuff with families. Sandy and Rachel, even though your services may not be specifically mental health, what have you seen in relation to mental health and emotional well-being in your services? Maybe starting with you, Sandy?
Yeah, look, I think it's important to differentiate too around, you know, mental health. Particularly, you know, in light of all the poor publicity it actually gets, you know, through the refugee health nurse program in the 40 or 50,000 people that we've cared for over the years. Probably maybe a dozen people have arrived with quite a serious, persistent mental health illness or diagnosis that, you know, we would classify as the classic stuff like schizophrenia. Sadly, I think the reality is for people that have that really serious, persistent mental health disease, often they don't survive to get here. So I think that's the first thing to think about. So there's sort of good and bad in that. And look, when we see people after arrival, they're still in that psychological state, if I could call it, of enduring. So they've been enduring for years and months where they've had to stay together. They've had to keep it all together. And when they arrive, they still have to do that because settlement is actually quite overwhelming. Settlement is a huge thing to do. New country, new language, you know, finding accommodation, getting kids into school, finding a GP, working out where does the bus stop and how do you get on and off, and all those sort of activities of daily living that you and I just take for granted is an additional pressure. So I do say to my staff, look, while people are in this state of enduring, they've actually got a lot of energy and a lot of focus. Let's keep that going. Let's not intervene too early, because when they stop enduring, often they implode. Often it's overwhelming. So I think Sharon would agree. We would see that around 6 months is often the tipping point for people. So you may not see that on arrival, but the reality of settlement, once people have got all those things that they need to do, they've worked it all out, and then they actually have time to sort of sit and reflect and go blah. So I think it's important that for wraparound services and what services look like, that those services are available not for a really specific point of time. People have different times for that, and we do have programs that say, oh, you get support for this time or that support for that time. I mean, they are flexible, and you can always, you know, apply for individual support. But it's important to realise that everyone has, you know, a different timeline, and people come with different skills and different attributes. But yeah, certainly, Mona, that family conflict, the parenting conflict, particularly with young teenagers who arrive who might be bilingual, and they become very powerful within the family unit because they can speak English, and they're the ones out there negotiating and, you know, often in that sort of stuff. So yes, they become quite a powerful person in the family. Thanks.
Yeah, thanks, Sandy. And how does that sort of then look, I guess, in the education space, Rachel?
Thank you. So I'll pick up on something that Sandy just said in a minute. First of all, we have about 12,000 students from refugee background with refugee visas currently enrolled in New South Wales Department of Education schools, plus all of the others who didn't come on refugee or humanitarian visas, but other visas with refugee-like experiences. So I feel that's quite a large number.
Mm.
I just want to speak about Sandy's point just then in terms of a timeline before I forget. It's really interesting that 6 to 8 month period, that 6 to 8 month mark. So, you know, like on first arrival, there's, you know, like that experience of euphoria, safetiness, happiness. We're here, all good, right? And then that, as Sandy kind of just described, almost like a descent into, oh no, now what? You know, we're finally safe. We can take a breath, look around, and look what's happened, and start processing. For our teenagers, or for those who have access to intensive English centres, for the first 6, 8 months, at that time where they're still feeling fairly like pretty happy that they're here, they're in an intensive English centre, which are highly supportive environments, very, very, very caring and very understanding of the needs of students from refugee backgrounds. Then as they are transitioning into mainstream high schools, which many are very supportive as well, but it's not like an intensive English centre, at almost exactly the same time as they and their families are starting to finally process and go through more of a hard time, just because of a timeline, not even because of what they may have been through. Any migrant would experience this, is when they're transitioning to a mainstream high school. So which as I said is can be very supportive, but nothing like an intensive English centre. And so that shock to the system happens at about the same time. It's pretty hard. So in our professional learning for teachers, we do include that little piece of information. But yeah, the kids, you know, they have trauma backgrounds, which can lead to sort of hypervigilance sometimes, and react sort of overreactions to things that their peers may not react to in the same way, who haven't had experiences like this. You know, there's issues with safety, trust, attachment, responsibility, and skills. Those things, particularly belonging to the school, come up. So they are kind of like just the main points in terms of what we may have noticed relating to mental health in schools. That's a fairly basic high level summary. Of course, there's a lot more detail there, but for the purposes of today, that's just kind of like a simplified explanation at the moment.
Yes, no, I know we could probably have a very long conversation today about the issues, and I realize I didn't ask Amanda again if there was anything else you wanted to add. I know that was quite comprehensive, but there might have been something else that you've seen with the consultations, and don't forget to unmute.
Thank you, Emmeline. I think just to add, I just want to stretch out the journey a little bit, the journey that people come on. So we've got, you know, the pre-migration phase where people are exposed to things like war and violence, family separation, perhaps imprisonment or detention. Then we've got the journey section as well, where we see people who've come to Australia on a plane, they've gotten on one side and come and arrived in another, but we also see people who've lived for years in transitional countries where access to basic living essentials may be difficult, or there may be discrimination. I've certainly seen families who've faced really strong healthcare inequities while in transitional places as well. So, and then on top of that, we've got the resettlement stress that we've been talking about, and that's where most of our conversation has kind of been centered today. But of course, what people are drawing from when they're facing traumas after they've reached that point of safety draws from those earlier phases as well. And then I just wanted to think about some of the younger children as well, because my role is particularly with children and families. So when parents are distressed or using all of their resources to adjust and adapt and manage all these different things, the style of parenting may change, and there'll be fewer attachment resources for the children. And so there's a less stable base for the children to be kind of moving forward into the world with. So then that's when you get with younger children, separation fears, or maybe some challenging behaviours. And then, of course, the parents are facing the barriers to care that are barriers to accessing care that we know that many people from culturally and linguistically diverse backgrounds face. And so conditions can kind of carry on for quite a long time before help is sought. That's all I'd have to add.
Thank you. So I guess now looking at then how do we support families when they attend services and have these issues? So how can we help families do more than just survive when they present with such issues? What has the research said, Associate Professor Unan?
Okay, thank you, Emmeline. So I guess, again, kind of linking it to that idea of, not to pathologise what often are quite appropriate and normal responses to the stresses and experiences that people have encountered, at that kind of pre-migration, at flight and then on arrival. And incidentally, I think, Sandy, you picked up on a really important point. And a lot of our research has shown us that the stresses associated with resettlement can often overwhelm people more so, when we've done some analysis, than the stuff that's happened to them, pre-flight. So, often we don't think of that. We think we're focused on that kind of concept of PTSD and traumas and things like that. But this whole notion that what happens here and how it has an impact on people's responses, we probably don't really realise how important it is. And so it's a really, kind of a factor to be always thinking about. But from a research perspective, so linking to that kind of looking at what people's strengths are and their, kind of underlying capacity. My research team, another PhD student of mine, has been looking at the concept of self-care. So if we think about mental health in that kind of Australian mental health step care approach, at that universal preventative level, I think we have an opportunity to intervene. And really, there's been very little work done on looking at what works for refugee communities. We know what works for the mainstream Australian community, but what has been done there in that kind of this population group, not a lot. So we've, been focusing more so on this in the last few years, and we've looked at initially doing a, very large comprehensive systematic review where we kind of looked at across all types of research. And we focused more so in Arab populations because that is and has been a large kind of group of people resettled in Australia. And what we found was that, there are 4 types of self-care approaches that seem to be working for, Arab populations. And they're not very different from what you would expect in that kind of general population. So one of them is around social kind of self-care. The other one's around psychological self-care, and that's kind of linked to what would happen in the general population. We've got, this one's a little bit different. We've got focused a little bit of work around religious self-care or spiritual self-care. And then there's all of these others, like expressive therapies, exercise, things like that. And so we look at those and we found, okay, there's some similarities across the general population, but what makes it quite interesting is how we contextualize it in these communities. And every piece of self-care has been found to work best when it's in a family context. So things like, you think to yourself, well, psychological self-care, these are things like, structured problem solving. And when we look at the research evidence, it's like, well, we would like to go to families. So we go to family members when we're faced with a problem, or we go to an elder when we're faced with a problem. So, it is problem solving, but it's in that kind of collective experience. Things like, social, social self-care, that's quite clear. We can understand that. That's, kind of engaging across the community. But even, spiritual things where you think it's a one-to-one reading the Bible, but it's also, it's that social aspect of going into church or, the mosque or temples and so on. So the research is showing that, if we do things, whatever we are doing, we need to kind of contextualize it in that kind of collective experience.
That's really interesting to hear that, because I guess we often think about self-care as health professionals. We think of that as an individual rather than thinking about that collectively or within that sort of context.
Well, it's a tricky term, the word self-care. Immediately you think to yourself, it's self-care, but the self-care happens in that bigger dynamic, in that bigger group. Yeah.
Yeah, great. So I guess how does that look then? Thank you for that, Associate Professor Yunan. What does that look like? I guess how do we support families then? What do you guys do in your everyday work? Can start with whoever's ready to speak up. Maybe Mona.
Hi. For me, in this role, I'm not hugely working with families or individuals with refugee background, but here and there, I do get the privilege of working with this beautiful population. Whereas in my previous jobs, it was in a mental health setting and then refugee work as well, and then large portion of it working with asylum seekers. And I guess one thing that was quite important for me, and then that was a learning curve for myself as an individual who had refugee experience, was that to be really conscious about not to generalize and make generalization about refugee experiences. And then also pay attention to details. People are unique, notice them, notice the differences, notice the changes. And then try to be a beacon of light, and hope for them. They're not just some people that are wounded and scarred for life, and then we just need to, dress their wounds, but they are, full of resilience. And then how can I invest into that? How can I be so strength-based in my approach and trauma-informed that assist them for them to also to see their light. And that reminds me of like different people that I met in my journey as a refugee. Like I remember when I used to go to intensive English center, I did have a teacher that I still can remember her name, but unfortunately very bad experience. I remember every time she would talk to us, she would be like, if you guys could get to a TAFE diploma, that's the best you can do. Like I encourage everyone not to think about even university degrees or anything, just try to get something, get into the workforce. And that was very upsetting for someone with me who came to Australia because of not having human rights to be able to access education. So one of the purposes in my life as Mona, who traveled all the way from Iran to Australia as a Baha'i, was that I wanted to access education. I wanted to learn things and give it back to people. So that was too huge for me when hearing that from a teacher that's supposed to be a role model and a safe person, person that would guide, show the way to you. But then down the track, I met wonderful people at university. And then even though that during my undergrad degree that I really struggled with English being second language, I got awarded for being a hard worker. And then that award for me, like really encouraged me in the rest of my life. So what I want to, like a message that I want to share is that sometimes you don't need a lot of frameworks here and there and therapeutic. Like refugees often come from, and I just say often here, that from collectivist backgrounds. And then here in Western society, we follow individualistic kind of therapeutic frameworks. And this is very different, not to bring it down, it's just very different. I was seeing my dad struggling with this illness that would really drop my mood every time I would go to school. And then people would think that it's because of the stress from English being second language. Yes, it was, but then it was hugely impacted by the parentification that was happening to me. And I had to grow up over a day. Like literally, I was 16 when we arrived here. Suddenly, I had to turn into a caseworker, a carer for my parents and my siblings. So it was very tough. I don't know if I could share the message, but something along those lines, like consider the family as the person, that big person, like they are one human body, the family. It's not just dealing separately in isolation.
Thank you. Was there anything else to, I guess, what goes on, I guess, in your everyday work, Rachel?
I knew that you were going to ask me next because of Mona's kind of connection to education there and her experiences. So thank you. Yeah, definitely. Look, schools are a very important part of the recovery for students from refugee backgrounds as well as their families. The kids are at school, or pretty much ideally all day, 5 days a week. And the families, I'll speak about families in a moment, but I don't really know of any other support agency who has that much contact with people whose lives they affect so strongly, right? So schools have an understanding, or schools who have high populations of refugee students have a pretty good understanding of the kids and their families and their backgrounds. Now that we have the Ukrainian refugees coming and kind of spreading across the state, plus we have the community volunteer programs that are helping with settlement, it's a little bit harder. So we're sort of working to try to, get more schools having an understanding of refugee education. But schools are definitely important. The first thing, well, all schools, no matter if they have communities from refugee backgrounds or migrant backgrounds, all schools aim to bring families into the life of the school. Like that's always on their school plan, right? You click onto any website, any school's website, and you can see their plan for that year. They are always looking for community engagement and engagement with families. What is the refugee communities and the refugee families are really very difficult to access because of quite a few reasons. I mean, language is the first one to come up, but that should not be a barrier because there is many kind of there's translations and interpreters available. But also I think a lot of families, or some families, are maybe in a way kind of intimidated by the school. The schools have fences all the way around and a lot of actual physical barriers, but it's more than that. I think education is so highly respected in many of the countries where our refugee families are coming from that it's almost a little bit of intimidation. Like they feel that schools are, everyone there is university trained. They're, like a very, very, almost seen as probably an elite group of people inside the school. And what schools would far prefer people to know is they are welcome. Their voices, their contributions, the schools are just trying all the time to get families in. So there's that. The other thing is information. What a lot of families don't understand is school. Like they've come from countries where the systems are so different if there is schooling available at all, right? And so they don't, it can be very difficult for them to have an understanding of school. And so that's where, schools play a role, and the Department of Education plays a role in trying to give families an understanding of what goes on at school, what school looks like, like what their children are doing each day. So that's pretty hard. And the other thing that I think would be good for families to know is that their kids are under a lot of stress. They see their children going each day and they see them their oral English language improving all of the time. What they may not see though is that the identity kind of changes that they have to flick between home and school. How language is still very, very difficult for the kids, even though their speaking is improving. Their reading and writing need a lot of support. So the families may be under a bit of a misunderstanding of how well their kids are doing at school on what they see, compared to then they get their school reports and don't understand why the kids aren't achieving at the levels that they would expect them to achieve because they are going to school each day. So there's, there's a lot of work for maybe the settlement services to kind of give an understanding to families about what the kids are going through and how difficult it can be.
Yeah, sounds like there's a lot. Sounds like there's a lot of support that needs to be given to families to help support their kids as well. Yeah, thank you. Was there anything that you wanted to add, Sandy or Amanda, in terms of what you would suggest? I think Sandy's unmuted.
Yeah, look, just to mention a couple of the programs that we run here at Refugee Health. The Refugee Nurse Program sees people on arrival and we move them through to primary care, but we've got 2 long-term management programs. One is the Child and Family Refugee Nursing Team. That's quite unique. It's the first of its kind in Australia. So we have our own team of child and family nurses that do sustained visiting and sustained contact with newly arrived families. And I think what's really fantastic about the program is it really does take a strengths-based approach, as we call it, in health, where they walk, they work closely with the mothers. And, these mothers are absolutely fantastic. Number one, they've got all their kids here, well, most of their kids here alive. Hopefully, inshallah, all of them arrive safely. And being able to parent and mother in extremely difficult circumstances. So there's that recognition of the strength and the resilience and the ingenuity often of mothers, how to keep a 18-month-old toddler occupied when the only thing you've got to play with is a clothes peg. Hey, think about that. So that's a really good program, and as I said, that really recognises the strength and builds on the knowledge that the parents already have, and often give mothers the confidence that they need and the reassurance that they need to say, hey, listen, you're doing a really good job, but here's another suggestion you might want to think about as well. And the other program that we run is our disability support team. We do see quite a few refugees arriving with various disabilities. And as Shamron was talking about, that sort of collective culture that people come from, in a lot of cultures, disability is really wrapped up in myth and legend and blame and tragedy. And so one of the great things about this service is about providing not just for the individual, but also for the family who've been caring, usually beautifully caring for their loved one with a certain type of disability. And we run For a Good Life, what we call For a Good Life. So they're community-based education programs. So we bring families together of people with disabilities where they get to meet other families. And that's that beautiful collective experience, again, of saying, hey, in Australia, it's okay for your child to have, this issue, because here's another family with this issue. And there are supports and there are resources that we can, wrap around this child or this young adult. And I think, for us, that's been a wonderful outcome, is seeing families blossom, relax, share experiences, and they really find, a lot of comfort and support, again, amongst that collective community. So it may not be their particular language or ethnic group community, but it is actually that community of families with children with disabilities. So they're just 2 things that we do. We saw the need for that. We jumped up and down till they gave us some money to run it, and we'll continue to run those programs because we know it works. Thanks.
Thanks, Sandy. Are those programs, in terms of like the information on your website? Just
sure. Yeah.
Cool.
So both, so child and family nurses see, they specialise in children under the age of 5. So we see women prenatally before, so we make contact with mum before she has her baby, and then we pick up their care after they're discharged home. And with the disability support team, those referrals are on our website as well.
Oh, great. Thanks. And we'll share the Refugee Health Service website at the end. I might just ask maybe I'll go with Amanda, like what kind of tools or strategies do clinicians use to help refugee families thrive, to sort of complement what we've been talking about so far?
Yeah, so my role at the Transcultural Mental Health Centre is to facilitate children and families access to timely access to assessment and to treatment. Sometimes that means guiding other mental health practitioners as they're navigating systems and trying to bring together all the different kinds of services that we're seeing represented on this panel today, actually, because we do know that that from the research actually that the resilience is no longer thought of as an individual construct, but it's actually about all the services and the systems around newly arrived refugees working together. And we've kind of touched on that again and again today. So definitely trying to help the different services work together is a strategy that we use, or that I definitely in my role can offer to the broader health and mental health service. I can be a point person to help guide you as you work with a family. We also work hard to remediate barriers to care, because we know that people from refugee backgrounds or who have refugee experiences experience inequities. It doesn't, just having equal access to care doesn't mean that they're going to have the same health outcome as every other Australian. They may need special attention and help to achieve the same kinds of outcomes. So we definitely offer multiple ways to access care. Through Transcultural Mental Health, we can have referrals for new arrivals, often through refugee health services, or people who disclose a refugee experience midway through their treatment with another mental health service. They can be referred directly to us by that service. We have the Transcultural Mental Health line now, where people can self-refer. So we're trying to offer lots of ways for people to access services more easily. And to do that, we need to work with clinicians as well to help elicit disclosure of refugee experiences, especially if it's not coming from refugee health services when they've just arrived, but they've been in Australia for a while. They've gone past the 6 to 8 month time frame. And so asking the right questions and just collecting a broad history from people, often about their migration history, will be when it comes out that they've had an experience that is contributing to their mental health presentation. So we work with clinicians to help elicit those referrals, and then also with communities to help communities feel less stigma and shame about accessing care. So we provide many ways to access care. When they reach transcultural mental health, we just really want people to engage with the broader context for this person, not just their migration history, but beliefs, political issues, cultural health beliefs, these actually apply to the broader culturally and linguistically diverse population, but equally to people with refugee experiences, and are just not always asked in your usual kind of mental health service contact. I think I'll just finish by sharing a story about how I've helped work with one family who were looking to access treatment. It was a situation where there's a child who's in a school actually that seems to be a poor fit for that child, and they've presented with developmental delay, and so it's a complex picture, but they've been put into a normal mainstream public school, and then the referrals for looking to try and get them out of that school by doing a cognitive assessment. And everyone's kind of running around in circles trying to get this child into a place where they can have an assessment, but there are wait lists, as you all know. But actually by linking up with education, with the student counselling, the refugee student counselling support team, there's another pathway to solve that issue. And so helping provide some guidance to those clinicians as they work with these families and navigate all those services, it can actually be quite effective to provide a systematic kind of support response. We also know that post-migration experiences, when you have a supportive or a beacon of hope, as Mona has said, kind of experience after arrival, can protect against PTSD exacerbating or something like that. So we really want to just offer as much as we can on arrival. I think that's a pretty helpful place to finish.
Thanks, Amanda. And look, I guess that's really because I guess the last sort of question was going to be around this holistic wraparound service for refugee families. What does that look like? And I think everyone's kind of put bits and pieces throughout our conversation so far, around thinking about this as families, as a unit, as a collective unit, rather than just the individual, if that's a child or a student or an adult. So I guess, is there anything else that you we want to add to that around what holistic wraparound services look like. Please, Rachel.
When I hear wraparound services, obviously I think of the mental health community and the terminology as it relates to mental health. So when I'm thinking about wraparound as it relates to education, it's the answer is sort of the same, but we don't call it wraparound. We call it support, like school support, support for students from refugee backgrounds, things like that. But the way we have to wrap around support for the kids is, obviously, they need to learn English language. Many of them have literacy, like they don't have literacy in their first language. So learning to read and write in English is hard enough when you're learning English. But actually, when you don't or have limited literacy in your first language is really, really hard. So there's like that double kind of that double conflation of background and issues there. So you've got language and literacy. Of course, wellbeing is already a very acknowledged part of refugee education and the support that the kids need, but also the missed curriculum as well. So we could have students enrolling really late in high school, like, year 9 or 10, and be studying the curriculum. So studying maths, English, science, all of that, without having had all of that building that knowledge from kindergarten. So broadly, wraparound for us is like trying to get the curriculum into their world. Language, literacy and wellbeing, but just to focus on wellbeing really is probably something that you guys are all more interested in at the moment. We do thank you so much, Amanda, I think, for mentioning the Refugee Student Counselling Support Team. That was on my list to speak about. So we have a specialist counselling team who can provide information, skills, expertise to the school counselling, the existing school counselling staff. We do have input from STARTS. Of course, we have a lot of connections, the school liaison team or school liaison program, plus many other aspects of STARTS. So we have teacher knowledge. We have a lot of professional learning for teachers as well that doesn't just talk about the experiences and background, but also looks to bring out the strengths in the kids and play on the things that they do bring to the classroom. And a big part is self-care for teachers. So, or not a big part, but a part of that is making sure that teachers are healthy and not traumatized by the experiences of their kids, of their students as well. So that's kind of wraparound from an education perspective, which is kind of different from a mental health perspective, but that's kind of how I tried to summarize it, really.
No, that's great. Thank you. And I think that is really important to think about the teachers as well, so that they can continue to give.
Yes.
Because that's what we have for our clinicians, our mental health workers, looking after their self as well in terms of self-care, given that they're the most important tool when we're talking about supporting refugee families. So was there anything else that anyone wanted to add about this, the idea around holistic or support around families? Probably should name someone, otherwise we'll sit here waiting for someone to respond. Associate Professor Unit, is there anything else you wanted to add?
Well, I guess speaking as an academic, I mean, our business is in developing evidence. So we look to the evidence and we think, well, where is evidence that needs to be further refined or developed? And hence why there has been this kind of focus by my group on looking at things like, how does low intensity mental health care work within refugee communities, what works for them, what matters for them. And that's been a focus that we've been working on in the last year or two. Pockets of populations, like Arab men, we often think of younger population, women, and all populations and subgroups are very important, but there's probably areas that further evidence can be developed, and I think that's what another group that we've been looking at. And I think that's, I guess one more thing I wanted to do, it just occurred to me when we were talking about working with young people and families and the idea of, we're very much familiar and confident in the approach of the systems-based approach, with young people in terms of mental health. But we sometimes forget how important it is for older people in this group of population. And I think, that lens or thinking about, a woman who's 65, what are the systems that are supporting her? We cannot forget that, or a man. And I think, there's a lot of, again, areas of research that are starting to develop, where we're looking at older refugees as well. I mean, I haven't personally been involved a lot in that, but that's also another group that I think there needs to be further kind of evidence development.
Yeah, no, great. That's really great points. Just thinking about that, sort of taking that intersectional lens, that we're not just talking about country of birth, language, ethnicity, but also maybe life stage or developmental stage of the individual in the context of their family and supports.
Can I say something?
Yes, please.
Thanks. I just want to have a word to the mental health providers who are watching today. I just really believe that having really broad context to our clients is so helpful. So we have some tools that we offer through Transcultural Mental Health that try and elicit that kind of broad context, something like what we call the Transcultural Assessment Checklist, something that's freely available. You can Google Transcultural Assessment Checklist and you'll be able to access it straight away. This is just a series of questions that asks about the broader history of the family, because having broad context to a case can help mental health care providers to form hypotheses and treatment plans that take into account that broader maybe set of supports, untapped resources that a family may have access to, but also it helps you to advocate when those supports are missing. So I just really want to encourage that, because that helps us to identify what services need to be kind of called upon to create that wraparound effect.
Yeah, no, great. Thank you. Sandy, I can see you unmuted.
Yes, just a couple of things before we finish. I know that there was a supplementary question that was put forward before the seminar, Emmeline, and one of the questions was around supporting women who come to Australia on partnered visas.
Oh, yes.
Where there's issues around family or domestic violence. And the person who put in the question was concerned that there is no support. So I just want to reassure people that's actually not the case. There is various financial, legal, casework support available, and it includes things like the Salvation Army, Samaritan Women and Children's Services. There is the new New South Wales Multicultural Centre for Women and Family Safety. There's financial assistance. It's only a one-off payment, but from the Australian Red Cross Family Domestic Violence Program, and JRS, so the Jesuit Refugee Service, and that's for any visa type. And they provide financial, legal, casework support and housing. So that's some good news that people need to know about, and well done to those people in the community. And look, I just want to say too, from a refugee health point of view, what's lacking, even though we've got a marvellous program and nationwide, what we've never had in Australia is actually a refugee health framework that can be embraced and supported by both the state and the federal government. So we've always had this disconnect in that the federal government runs the humanitarian program, but states actually provide the services. And the state government's view has always been, oh no, refugees, mate, that's all the feds, they bring them in, blah, 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 blah. So we're working very hard behind the scenes in what we call the REANA, which is the Refugee Health Network of Australia, with some ongoing meetings with the Department of Home Affairs to put forward a refugee health framework that would be adopted by states and territories, and with a memorandum of understanding between the states and territories and the federal government in regards to what we think a refugee health framework should look like, how it would be funded, what positions does it do, so that we've got consistent service delivery across states, including rural and regional, because we know with GPs, for instance, they're the mainstay of health for a lot of our communities, they have enormous trust in doctors. But, you know, where we've got regional areas where it takes you 6 weeks to get an appointment to see a GP, there's got to be some other models of care that are put forward. So that's in the background. We'll keep you posted on that. Thanks.
Oh, thank you for sharing that, Sandy. That's really helpful to know, because that's one of the things that can be really hard, even as a health professional, let alone families trying to navigate the health system and where to go. They don't care or know whether it's federal or state funded. And then if we don't know, how are they going to know? So that's really good to hear that's in the works. And thank you for sharing also your response to that question that came through the registration as well, because I think that's what I was basically going to open it up, open up the floor to any more questions that might be out there in the chat box, or if someone wants to just, I think we've hopefully enabled microphones and cameras. If anyone wanted to share any questions that they had coming from the conversation that we've been discussing about families, and also thinking about individuals, both young and old, in the context of their families. So I think Virginia's camera's come on, so I'm just wondering whether you wanted to share oh no, okay, you just wanted to share your camera. That's fine, not to put you on the spot. I thought I would just, while we're waiting for questions to come up, just to share that we actually have some upcoming learning and events. So there's an upcoming virtual workshop that we're going to run through our program. It's a two half-day workshop focusing on culturally responsive mental health care. And the dates are on the screen. And also the New South Wales Refugee Health Service, in collaboration with STARTS and other refugee organisations, is running the refugee camp in my neighbourhood. It simulates refugee camp experience, and that's on the 7th of August. And we're going to share the link in the chat box. And I find that a really valuable experience, so that if you go, I encourage you to go along to that. And there's also an upcoming online forum on engaging effectively with refugee communities, hosted by the New South Wales Health Multicultural Communication Health Services on June 20, and we're sharing the link in the chat box as well. I'm just seeing if there was, okay, so there's a question. Hello, could information referral services be sent to attendees? Yes, so we will be sharing the link to services on our Refugee Week page after the event, including a recording of this session, so that you can have that easily accessible to you after the event. Not sure if there's any other questions. And while I'm talking, I'm just going to say we like feedback here at TMHC. So if you can scan the QR code or click on the link that we've shared, hopefully we'll share in the chat box. Let us know how we can improve our webinar, or any other ideas or topics for future webinars in the transcultural refugee and migrant space. And if there's anyone in the audience, like through our discussion, if there is anything that you think we might have missed in terms of information on services, feel free to share that in the chat box. And as I said, we'll share the resources today on our web page. I don't know if there was any other questions or any other, I guess, last couple of minute comments, from the panelists that they wanted to share, if they've suddenly thought of something that they haven't shared, even though it's been a really good conversation about what we could do as clinicians and as health workers. Was there anything last minute that anyone wanted to add, as we've got 1 minute left in the webinar?
Emma, it's Maria here.
Yes.
My observations, and I guess just to take home messages of what I've heard from the panel today, and also just from a transcultural mental health perspective. I think what we've come up with is that families and refugee families are diverse and complex and have strengths and challenges, and that we just need to remember that these similarities and differences within subpopulations and across populations as well. And that the other thing I think that was important and highlighted is that children and families have multiple cultural identities that shift over time. And I think we've got to remember age and when children come in and families and their makeup at the time. You know, are they coming in with adolescents? Are they coming in with children? Because that's all part of the collection of information that's really important to create that picture that was being discussed. So it's that fluidity of culture that needs to be acknowledged and explored as we apply this in our everyday work. I think also, what I want to touch on is there may be also alternate understandings of mental health and a range of ways of expressing these difficulties. And I think that's important for services. So children's emotional or behavioural difficulties, etc., when they come out of conflict zones, need to be considered in that cultural context. And I guess developing relationships across cultures requires just that ongoing communication across services, and that's what our services are trying to do, and the panelists really expressed that in lots of ways. So positive relationships across services is vital. And I think last, and this is just my reflection over time working with families of refugee background, is it's not just about the cultural sensitivity in some of these programs, but it's that two-generational focus on mothers, fathers, extended family and children as well. That's important. And to not miss those young people that are born in Australia as well. So, you know, 10 years down the track, knowing some of the intergenerational and the conflict that often they're exposed to as well. Yeah. That was just my observation.
Thank you, Maria. Thank you. And thank you all for coming today, and in particular our panelists, Sandy, Rachel, Mona, Amanda, and Associate Professor Uden, for being part of TMHC's TransFORUM for Refugee Week. And I also want to give a special thanks to my TMHC colleagues in the background providing support, and those that aren't here today as well, and Maria in assisting and putting this all together, as it was completely a team effort. So please feel free to get in touch if you have any other questions that come up from today's webinar. And I wanted to give the final words from husband and father Hamid Hadi, a Yazidi refugee, about family. Family is everything to me. When we survived the war, all we had left was family. If you were lucky enough to make it alive, it was the hope of being there for your wife and kids that kept you going. Thank you, and have a wonderful rest of the day.